Matt Griffin here with a Smile Mentor. Hope you guys are having a blessed day, and I am in the practice today getting my 4-week checkup. Just got the news that everything looks great on all 6 implants. You'll see that in another video where we talk and hear from Dr. Skander and get to see the prognosis. But I'm waiting to talk to also Dr. Ratana, but in that process, I thought, well, let's go through and explain, since I saw this over there, the anatomy of a dental implant. And if any of you wondered how an actual implant works, you have a tooth that has gone bad, a failed root canal, or again, those that are smart enough to skip a root canal, which I personally would recommend. Waste of money, just get it over with. I mean, plus root canals, just start watching some of the movies like Root Cause, or do some research on, there's no other time you leave a dead tooth in your mouth or a dead piece of your body. And that's what a root canal is. You now have a dead tooth in there. But okay, so you have a tooth that needs to come out. They extract the tooth. Make sure they take out the periodontal ligament as well, which surrounds the root of the tooth that acts as the shock absorber. If your clinician is not, they don't have to be a biodentist or anything like that, but a biological dentist, but they still need to have a pretty good comprehension on removing a periodontal ligament. So again, this is one of the reasons why I say be careful of just going to a general dentist. There are some out there that do a good job. I don't want to just throw out the baby with the bathwater, but I also want to say a specialist is better, in my opinion. They've taken it out, removed the periodontal ligament. Now you're in for surgery. And this piece of it is what the actual implant is. Imagine having that in your mouth. I don't know if that would fit. But this, they will drill a hole just like you're trying to hang a picture. You first pre-drill and get it ready to rock and roll in that hole just the right size, and then you go in. They will go in and they will basically tighten that in and get that stabilized in there and to the gum level. Actually below the gum level, that piece will be. And then they will put in, depending upon if you're having a single implant. I've had them immediately loaded in the past because I was pretty adamant about that. I do a lot of public speaking and whatever, but so I don't want to be Toothless Joe up there, but unfortunately it did fail when I had that immediately loaded. So if they don't immediately load it, meaning put a temporary tooth on it right away, that they'll put a healing cap so that nothing gets inside, no bacteria and that kind of stuff. They'll put a healing cap, sew you back up, and now you're off to the races. And they give you, they'll check you multiple times, but let's call it 5 to 6 months. Pretty safe to say this implant has now osseo integrated into your bone, meaning it is now part of you. It's not coming out. You're not going to be able to spin it, which I've had happen where it just spins and spins. It's in there and it's strong. So now they will come in, they will take out the healing cap, and now they will put in an abutment. We talked earlier with Dr. Ratana about the kind of abutments that are out there. You have stock abutments, which I don't really recommend. That just means something like this, that no matter how the angle is placed, and again, remember, look at all the different angles that I have up there on my implants. It's not just like what you would think. What's weird is a patient who didn't go to school for this. You think, okay, just you got 6 implants around the deal. They're all flat. It should just fit, right? And it's not that simple. But if you so with an abutment, if you have a stock abutment, it's just, they're all the same. It's cookie cutter. Custom abutments will fit to that angulation so that your bite's better, everything. Make sure you ask that question when you go in for your consultation. For single implants, do you use custom abutments or stock abutments? Then you have your multi-unit abutments. Your multi-unit abutments are those that are used for multiple implant placement, so that you have the ability to take a prosthesis, like we had, yeah, actually, it's kind of handy to do this. So now the multi-unit abutment will basically be a connector to let turn the male piece into a female piece. Now, if you think about it, you have multiple abutments that can't be all just straight up, because again, looking at my x-ray, there's no way that would work. And so, of course, not that big, but so multi-unit abutments are much shorter. They will handle the gum tissue level, and that's really what they're going to use for the All-On 4. But getting back to, shoot, I need a little table here or something. Getting back to, by the way, guys, zirconia, that is heavy, sturdy, but and it can break. We dropped this from 40 feet before. We dropped also the nano ceramic and the hybrid, the PMMA, from 40 feet to do a test. We ran them over with a truck, did a lot of different things with it. This will shatter, so just know that the zirconia will and can shatter. But so now, getting back to it, they will, after 6 months, your implant's healed, they put in a custom abutment, and then they will do your crown. Now your crown, you know, I would always recommend, if you're gonna go get an implant done, a single implant, most I would pay is $3,000. That's the most. Absolute most, and that includes your crown. God, I know how much these things cost. Such a profit deal, but get an all-in price. Ask if bone grafting, ask if sinus lift, which those will be a little extra, and that's okay, because that's a lot of extra work and material and skill, and make sure you go to an expert for that, for sure, by the way. But the crown piece of it, it is not, especially for a single implant, is not that complicated. The All-On 4 way more complicated, but now you're getting to the crown portion of it, and they will then take the crown and seat it. Now, there's a difference between screw retained and cement retained. Let me keep it simple and just recommend go screw retained. Don't do cement retained. It will always have problems. Cement can get in places. It can cause infections. Don't do it. Do screw retained. And so ask them that in your consultation if you're going in for a single implant. But then they will place that crown, and then or the restoration process. You'll hear them talk about that a lot of the times, the restorative. So now I got a new twofer, basically. So now that's healed, you're at 6 months, and now you got a brand new tooth that, God willing, will last you a lifetime. No more root canals, no more abscess. I appreciate you guys spending a little time with us today and celebrating a good 4-week appointment after my All-On 6, All-On X, to hear how that's been progressing and healing. So that was good news, and all you patients out there know how rare it is to go into a dental practice and hear good news, right? Man, I can count them on probably one hand. I've had those appointments. So I'm pretty happy today, but appreciate you guys spending a little time with me today. And if you got any questions or comments, please submit them below. And those that have not liked us or following us yet, please do that. We really want to get the word out and help empower you and your friends and those that are out there that need to know about this process, and that there's hope and how to find the good guys and weed out the bad ones. So Appreciate you guys and hope you have a blessed day. Thank you.